Hey everyone, Dr. Andrew Orr here. Today I'm going to talk about the importance of iron and screening for certain disorders to do with iron. Probably many of you have already seen my post on Friday showing me having a venesection, and some of you already know that I actually have a genetic condition called hemochromatosis. And often people ask me, how do I know a lot about pain and different things? And like anything in life, we've all experienced many things. So, disease state. And I tell people, that I have not only a genetic condition, but I've had asthma and some other things that I've dealt with over my life, some of which can kill you. I've got two diseases that can kill you if they're not kept in check. But I think to be a good practitioner, you have to experience things. So, so when I talk to people, I come from a place of experience. Whether I have your disease, like I talk a lot about period pain, endometriosis, and often I get the "you haven't got a vagina" card thrown at me, which is really terrible, to be honest. But the thing is as a man and that has done a lot of experience and work with various conditions too, just because we don't have a certain anatomy doesn't mean we know about it. Some men actually know a lot more about women's conditions and women's parts and women's bodies than actual women do, and vice versa. We have women knowing a lot more about men's issues, and so when we get that card thrown around, it doesn't matter. It's terrible. It's the sexist card. We don't want to hear about it. Not true, not true, not true, not true. Having a condition doesn't make you an expert on it. Just like me having hemochromatosis doesn't make me an expert on it. I do know a lot about it now because I've done lots of research into it, and as a healthcare practitioner, I have to know about it. But also, I get the part about healthcare practitioners is we get access to journals and information that the general public just can't get at all. And PubMed journals that you can get online, or anything you can get online, are usually 10 years old, and they're not current research. And just remember, we do a lot of study to learn about this as well. And it's our job to know about this so that we are experts in what we're talking about. Well, the reason that I wanted to talk about iron is that I want to get it through to people about the importance of having too much iron or having too little iron. In my job, I see a lot of women, especially with really low iron, and the consequences of having low iron are just as bad as having too high iron. And we don't look at the importance of iron enough, because iron is also part of the hormone pathway as well. When we make our hormones, it's converted from cholesterol, and we get all our good fats from dietary sources like marine lipids and omega-3s and stuff like that. They're good fats. They get converted into good, the good cholesterol, and then cholesterol is converted by various enzymes into what we call pregnenolone, and then pregnenolone is then converted into other hormones. And to carry some of the enzymes that convert cholesterol into pregnenolone, one of them is iron. It's very, very important in part of the hormone pathway. So iron is something we need to discuss, because the symptoms of low iron and high iron are very much similar. So when my iron has been very, very high in the past, and before I found out the diagnosis, I actually had all the symptoms of low iron. Now, if I didn't go and screen for that and then ran off and thought, well, I must have low iron, and which I see a lot of people doing, especially a lot of women think, oh, I'm iron deficient because I'm tired, I'm fatigued, I've got dizziness, I've got headaches, I've got this. I'll just go and take supplements. No, don't do that. Without proper screening. So the first thing anyone should do is go and get iron studies done. So that's your first port of call for iron. Now, if your iron is really, really low, I'm just going to say to people one thing. you can do 12 months of supplementing sometimes and it's still not going to help. When your iron is below the reference ranges, go and get an iron infusion. Now, if your general practitioner or your healthcare practitioner or doesn't know about IV infusions, they need to, because the time it takes to bring your iron up could be a long, long, long time. And in that time, you've got the damage of what it can do to not only your bones, your brain, your hormone pathway, the whole lot. It's very, very dangerous. So it's about getting those levels up. Now, with an iron infusion, you can get your levels up back up to where they should be within about a couple of weeks. Supplementation can take forever. And the difference in the iron is very different too. So this is why when we're ingesting iron, it's in a very different form. And it's not always great for us either. This is why a lot of people have problems with their gastrointestinal symptoms when they're taking iron. And there's specific irons too that I can get that the general public can't get, that won't interfere with your bowel habits and if you ingest them. So I often give them to them after they've had their infusion. So they wait till the infusion brings their levels up. And then about a month or so, 6 weeks after the infusion, I start giving them supplements again, just to keep their iron levels up. Now, if your iron levels are low, we have to be really, really honest about this. It either means you've got a health condition, which could be celiac disease, inflammatory bowel disease, or IBS, Crohn's, ulcerative colitis, some form of malabsorption issue as well, or it's purely dietary. Now, if it's purely dietary, let's take diet choices out of this. Okay, if it's purely dietary, it means your diet is inadequate. Now, it's not having a go at anyone for their particular beliefs around diet. But the truth of the matter is, if you're not getting enough iron into your diet, you're going to be iron deficient. So you need to keep up supplements. You need to look at iron-rich food. And let's face it, if you are vegetarian or vegan, you are going to struggle to get your iron levels up. So that's why a lot of you are B12 deficient and you're iron deficient. Now, this again is not having a go. This is just purely on a health level. So you've got a supplement, and if supplements aren't working and your iron levels are crashing constantly, you need to have an infusion. And then you also need to look at, is it just purely dietary? Is there another issue? Because as a woman, not only that, you've got periods, and periods are loss of blood too. And if you're one of those women that have heavy periods that may have endometriosis or adenomyosis, or you could have a big fibroid or something there sucking the blood right out of you, there's another layer to that. So it's very, very important that we look at the whole picture. Is it just dietary? Is there a gynae issue? Is there this? And address the cause of your iron deficiency. Now, the hard thing about the next thing we're going to talk about is high iron and hemochromatosis. There's not much you can do about that. And we've seen recently on TV some celebrities come forth like Dave Hughes and that haven't been bleeding and doing venisections like I do, but have known that they have hemochromatosis. Now, there's a lot of fallacies around it, and I'll explain about autorecessive genes in a second so people can understand it, because hemochromatosis this is why I talk about endometriosis. One in 10 women are diagnosed, right, with endometriosis, and a lot of women are missed and dismissed over the years with gynae issues such as endometriosis. But similarly, just as many people are missed with hemochromatosis. The hard thing with hemochromatosis is that if you don't catch it in time and you don't do anything about it, you can die prematurely. I need people to understand this. You can die from this condition. And this is why it's very important, if you know that you have it, or you have family members, and I'm talking uncles, aunts, grandparents, parents, or someone in your genetic pool, cousins that have it, that you should be tested. And I'll tell you my story in a minute. But it can cure. So when we see these celebrities on there, now there's the fallacies around it as well. Because obviously recently we've seen the comedian Dave Hughes on there that hasn't been bled in 7 years. And all I'm going to say is you're an idiot. I don't mean that in a bad way, but you're an idiot, Dave Hughes. Big idiot. Once you have a genetic condition, an autorecessive genetic condition, you can't get rid of it. Being vegetarian, another false thing, is not going to stop you from having venisections, because it will still, your iron will still build up regardless. You can't, with hemochromatosis, it's not like other people who absorb iron, process iron, and use it properly. Ours stores up. Now, if it stores up, your body's going to store it in other parts of your body. And unfortunately, it will store it in your liver, it will store it in your heart, it will store it in other organs in your body, which will then have iron overload. They become inflamed, they become atrophied, and then you die. So we don't want that. Again, I don't mean to do the shock factor, but I think the only way to get through about iron deficiency and high iron is use shock factor. They are equally as bad as one another, and we need to actually look at them very much, very, very, very similar, and take them more seriously. So yes, being vegetarian doesn't stop you having venisections. So the reference ranges really is somewhere between about 20 to 300 when we're talking about our ferritin levels. Anything over that, where we've seen the likes of Dave, I think he started off in the 500s like 7 years ago, and now he's up around 700, 800. But, you know, even at 500, it's 200 over the outside the reference range. That means your body is starting to store iron, and it will be looking to store it in other parts of your body. So again, with high iron, it's very much the same symptoms as low iron. We get all the same symptoms. Now, the reason I talk about autorecessive genes is that I'll just bring up so people can understand. So here we have an autorecessive chart of the basically about the inheritance of diseases and stuff like that. So when you're like me, and I'll tell you my story in a second, it means that I have a double mutation. So I'm what they call homozygous. I'm not going to go into all the actual gene types themselves because there's quite a few of them. But let's just talk about heterozygous and homozygous. So homozygous means you have the double gene mutation. If you're heterozygous, it means you've got one mutation, you're a carrier. It doesn't always mean you're going to have issues, but there are rare cases, and let's not talk too rare, that you could be a carrier and still have high iron or iron overload. You might not have hemochromatosis per se, but you could still have high iron where you might not process your iron. So you have to be careful. Just because you're a carrier doesn't mean that you can't have high iron, and it doesn't mean that you won't have to do venisections. You probably won't have to do them as much as someone like myself who has the double gene mutation. So where it comes from is mother and father. So if mother and father are both carriers, then that means that somewhere along the line, either one in a family, someone may have the disease. So 25% will have the double mutation, as we have here on the right. Then underneath mother and father here, we've got carriers. So someone, if you don't have the double gene mutation, you're going to be a carrier by default, mostly. And then there are some cases where you are unaffected. So some people might not be carriers. But if you've got the double gene mutation, it means your mum and dad are carriers by default. So when I first found out by chance. I just went for checked my iron. It was part of an insurance thing actually, and it showed it was high. And I remember not so long ago, one of my uncle also was diagnosed with hemochromatosis. And I remember him saying to me, you need to go get screened, you need to go get screened. And I thought, well, why do I need to get screened? He's, you know, you're my uncle. Yeah, why would I? I'm not your son or anything like that. So, I was a bit complacent about it. But I didn't think about the genetic pathway. So if my uncle had it, it means that his mother and father were carriers. By default, they're carriers. But that also means that his sister is also a carrier, and then that sister is my mother. So I would have to be a carrier by default. But that also means what I didn't know, that would also have to mean that my father's a carrier. So that's how it happens. So this is the whole thing. You have to, just because your cousin or some distant relative, if they've got known to be a carrier, or someone in your family has the disease and said, oh, we've got high iron, you need to go get checked. One, to make sure that you don't have the double gene mutation, but also then if you're a carrier. So it's like me passing on to my children will be carriers, and they've already been screened. So all of them are carriers. But if they meet another partner who is also a carrier, then there's a high likelihood, 25% likelihood, that one of those children will then actually have hemochromatosis. So we talk about hemochromatosis, that 1 in 200 people have the disease, but like we talk about endometriosis, 1 in 10, but they're the people that are diagnosed. And there are so many people that are misdiagnosed because GPs, healthcare practitioners, natural medicine practitioners, I don't care what kind of practitioner you are, a lot of people don't understand iron, and they don't understand hemochromatosis, and they don't understand autosomal recessive inheritance and genetic gene mutations and stuff like that. I see that every day, that people just really do not understand gene mutations at all. So if you have a diagnosis like I saw on my page on Friday, where your iron is high, up in the 800s, where I saw some people up in the 500s, so forth, you need to go and get screened. And if your healthcare practitioner won't, go and find one that will, and you want to mention the word that you've just gone on and seen a doctor talk about his own hemochromatosis, and that I'm urging everyone to do it. If not, you can also ring Hemochromatosis Australia or get in contact with Hemochromatosis Australia, talk to them too, and they will find people that they might know that will help you screen. But I do not understand why someone, it's actually negligence if you do have high iron and you aren't screened. Let's be clear about that. It's negligence, and it is indicated that you should be screened for any of those autorecessive genes. Similarly, if you've got low ferritin levels, it's negligent to leave you low and then say, we'll monitor it, without giving you, look, you should have an infusion if it's really, really, really low, to be honest. Not let's just wait and see. No, do not ever let anyone just wait and see. All right, I hope that explains a little bit about it. If you want to know a little bit more, as I said, go on to Hemochromatosis Australia and have a look at some of their information. They've got everything you need to know about it. Go and talk to your healthcare practitioner, your family GP, or even go and speak to a hematologist if you really have to. If your GP isn't going to help you, just say, I'd like a referral to a hematologist, please, and then go and see a hematologist. Please do not leave your iron high, and please do not leave your iron low. Iron is very, very important, and there's far-reaching consequences, even premature death. And then plus all the other bits and pieces like head fog, dizziness, body aches, body pains, headaches, migraines, because a lot of people don't realise a lot of their migraines is from iron deficiency or high iron. So there you go. We're talking about iron today, and please take it seriously, and please don't just let it go on and on and on and just go, someone said, someone said, someone said. No, if it's low, get it sorted. Get an infusion. You need 2 of the Ferro Inject, the 10 mil, which are the 10 mil 500s. That's what you need as an adult, and don't take any less than that. And if your iron is high, then you need a venisection to take that iron away. And you've got to get rid of that iron. You've got to get your levels down. So for me, I try and maintain my iron levels down around about 90 to 100, not up at 500, 800. It's anything over the 300, you're in iron overload. Don't do it. It's terrible. All right. Thanks for listening. And I thought I'd just explain it a little bit better. Thank you. Talk soon.